through exemplary health care, community service, education, and research. We're a faith-based, not-for-profit private organization. We provide health care across 10 counties today in North Texas through a network of 14 hospitals, 122 primary care and specialty clinics, 22 ambulatory surgery centers, 5 short-stay surgical hospitals, and 7 faith-based clinics. We are one of only 2 adult level 1 trauma centers in North Texas, and we provided over $452 million of community benefit last year to the communities we serve, which includes charity care, the unreimbursed cost of Medicare, the unreimbursed cost of Medicaid, and our commitment to medical education and research. We recognize the need for appropriate, intelligent, and sustainable healthcare reform. And this includes a new emphasis on wellness and prevention, and rewarding positive outcomes and quality and safety that is demonstrated by transparency. And we also support health care that is affordable and health insurance availability that is affordable. At the same time, we want to also maximize health information technology, and also we want to protect the individual choice of doctors, hospitals, and health plans. Healthcare reform should not just mean billions of dollars of cuts to the Medicare and Medicaid reimbursement for hospitals and physicians. I believe all Americans should have access to safe, quality, demonstrated, affordable health care. Health insurance should be available, affordable, and portable. And individuals should be able to purchase insurance regardless of what pre-existing health conditions. Although the insurance question is critical to this debate, we must not and we cannot lose sight of the fact that having insurance coverage does not mean having access to health care. We have people who are covered by 2 public programs, Medicare and Medicaid, who have difficulty finding a physician because one, we don't have a physician. Reimbursement and excessive paperwork that these 2 public options make for our physicians. We must maintain programs like disproportionate share funding for safety net hospitals like Baylor, who treat a large number of uninsured and underinsured patients. And in states like Texas, we have many challenges because we are a border state. And there needs to be some way to address the undocumented workers who come to our facilities for health care, and because of rules under the we also recognize that the payment system needs to be changed. And it's a payment system that rewards evidence-based medicine, care coordination, prevention, and quality. Because if you recognize these attributes, you will change the models of care in the United States. We also need a focused health education initiative. We must improve the health literacy of our people so that they own their own health care. A level of personal accountability. One area of pride for the U.S. healthcare system, and I wish we would talk sometimes about what is right with the healthcare system in America. What we be proud of is our research and innovation. Healthcare reform should not take away innovation, but rather encourage it, because it is only through innovation that we can drive costs down while maintaining excellence in medical science and new technology. One of the greatest challenges in healthcare today is the management of chronic diseases. And the Centers for Medicare and Medicaid Services estimates that over one-half of all healthcare spending for Medicare beneficiaries involves congestive heart failure, diabetes, and other chronic diseases. Management of chronic disease will prevent frequent hospitalizations and interventional procedures. Patients do need a medical home for both treatment and prevention, including advice regarding education, exercise, and behavior modification. Changes in reimbursement, physician and nursing education, as well as integrated allied health extenders will help us impact the cost curve. Also, as we consider reform, we must concentrate on finding the most appropriate setting in which to deliver care. To increase value, patient care services must be coordinated across people, functions, activities, location, and time. Care should be centered on the needs of the patients and their families. Health care is local. Health technology is provided care coordination around the patient is the first step. We at the Baylor Healthcare System are not waiting on Washington. We are going to make decisions on behalf of our patients and the communities we serve. And by working with our physician partners, we are seeking to develop what we refer to as an accountable care organization that links the delivery of care over time, physicians, and locations. We believe that this will be a new model of healthcare delivery for the future and will help us achieve our vision of being trusted as the best place to give and receive safe, quality, compassionate care. We want to continue to put the patient at the center of all that we do, and these accountable care organizations emphasize patients having a medical home, prevention and wellness, and the management of chronic diseases. And we believe working with physicians and creating physician alignment must be a building block of sustainable healthcare reform. One of the reasons that we experience a high cost in healthcare today is because of the fragmentation and the misalignment of hospitals and physicians. Baylor has successfully partnered with physicians in a variety of ways, including joint ventures for ambulatory surgery centers and joint ownership on specialty hospitals. The results have been outstanding for the care for our patients. We always get the highest patient satisfaction scores in these facilities, as well as demonstrate a high quality. You may have seen the recent article in Dallas Morning News, also carried in USA Today, where our joint venture heart hospital, the Baylor Heart and Vascular Hospital, was recognized as having the lowest admission rates in the country for heart failure. That's because we're aligned with our physicians and we're able to come up with standardization, we're coming up with protocols, and the patients are being treated in the most quality, efficient way possible. And it is our hope that Washington will find an acceptable compromise to allow these models of care to continue to meet the needs of our patients and the communities we serve. Thank you for allowing me to share my thoughts, and I appreciate each of you for being here this evening.
Now, where are the people with the brown bags that are going to collect questions? Where are you? Raise a hand to tell us where you are. Somebody doesn't collect the questions, we can't get them up here in front. I think they're on their way. While they're on their way, I would like to ask the congressman if they would like to respond or pose a question to our panelists. But also, if one of the experts has a question to pose to a member of Congress, you can do that too. So let's have that. Who wants to go first? Pete Sessions.
Are we asking questions?
Oh, we're asking questions. So here's the question I have. The question I have is, if we allow a compromise that would be done in Washington, D.C., Joel Allison, what would be a major compromise that we should be asking for that the healthcare industry knows would make it better? I heard you talk, but there's a good compromise, and that